Welcome to the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.
With the best healthcare attorney in America, Harry Nelson, here in Los Angeles. We've had a great discussion. If you got to listen to part one, if you didn't, go listen to it, because we're covering everything from the election of Trump and the GOP majority and what you can expect in his first book to, in the second part, we're going to talk about what his next book talks about and some of the events that both Harry and I will be participating in. We find ourselves presenting at a lot of the same events because we're both rallying for the same things and have expertise in the same areas. He's the legal expert, and I'm just the expert in operations and how to do it, and that's why we collaborate and why we get along so well. So I hope you enjoy this part two of my interview with Harry Nelson. Harry actually brought up a couple more of the steps to health wealth. He talked about artificial intelligence and machine learning, and I don't know that there's a whole lot more for us to say other than that data that's there is being used and fed back in. And for your personalized health plan and for your preventative health plan, AI and machine learning, as soon as you can figure out how to input it and implement it into your plan, it's going to make a massive difference, isn't it, in reducing your costs?
Absolutely. No, I think it's going to be a game changer. We're already seeing a lot of health systems starting to use machine learning for different population health analytics, and I think employers should absolutely be looking at it, and individuals even, as I'm mentioning, like solutions that allow you to track your health over time, and data that historically wasn't. We know who looked at their blood test from a few years ago and their blood test today and thought about that. There's machine learning is what makes it possible to draw conclusions. So I would encourage individuals as consumers to be on the lookout for ways that you can use machine learning to stay on top of your health.
Even your data from wearables or your Fitbit or whatever it might be. So Harry also said something I want to go back to about kind of the end of days on which pill is best for you. And step 9 in health wealth is integrative medicine or naturopathic medicine. A lot of you guys would think of it as Eastern medicine. And my friends at Harvey, Integrative Medicine Company, Kyle Hill, Mike Townsend, the founders there, they're here in Los Angeles. They're the ones that actually turned me on to this when I was researching health wealth. And in my research, I learned that there were more than 100 university programs in integrative and naturopathic medicine in the 50s and 60s in America. And Big Pharma came in and squashed it and convinced us that if we're sick, we need a pill to get better. And actually, it's one of those moments when I was researching and reading about it that I said, yeah, I'm a Gen Xer, and that's exactly how I was raised. If you're sick, you take a pill. And the conversations that I would hear between my wife and I when the kids or myself wasn't feeling sick were always about which pill. It wasn't about what remedies to take. And so we've seen this movement back towards, hey, it doesn't have to be all Eastern or all Western medicine, but how about a little bit of each? And that's what step 9 is about. And you talked about naturopathic methodologies and kind of the end of days from just the 800 or the 600, 400 milligram pill. Expand on that a little more, because I think it's a combination of 3 things. Millennial culture is becoming American culture. The Trump administration, as much as they're for free enterprise and capitalism, they're really taking it to the pharma industry more so, I would say, than their predecessors. And now you have this movement back towards saying, hey, we've been kind of duped by big pharma, and now we want to live healthy and consider natural methods to healing. So tell us where you think those 3 things combined are going to take us.
I think, it's an interesting, I think it's a good point. We've definitely seen a transformation in terms of openness to integrative medicine. We've seen a lot more. It used to be dangerous. There was a point when medical boards would go after doctors and other health providers for using integrative approaches and claiming that they weren't evidence-based. And I think that I think there's a lot of we see a couple things. Number one, we see patients want them, and we see that they make a difference, right? That so much. I mean, I'm a believer that so much of our health is also state of mind related.
Sure.
And that if you are activated in choosing a solution, a homeopathic solution that may have been around for centuries, that there's great wisdom there. At the same time, we are seeing incredible new molecules coming out of Big Pharma. So we don't want to throw the baby out with the bathwater. I think Washington, D.C. tends to give us these villainized Big Pharma. But I think for smart consumers and for employers, it's both, right? You got to find the right solution for the right problem.
And that's really, we've talked about several of the health wealth steps, and that actually wasn't by design. It's just Harry and I are both experts in the field, and we get together and talk. We talk about these things that our customers and clients are talking to us about. And really, what health wealth says is this: is as an employer, if you have 500 employees or more on one campus or in a nearby area, great opportunity to put a clinic on site or to find a primary care practice that's right across the street and go talk to them about DPC. Same thing with telehealth. Set aside a small room that's equipped for DPC, and I'll say it again, I say it every time, for telehealth. Every time I bring this up, I'll say this. As boomers and some of us as Gen Xers, I don't want my employer knowing about my health care. Guess what? There's a federal law that prohibits that from happening, so we don't need to talk about that anymore, okay? If your employer is going to set up a room so you can, during the workday, just step out for 15 minutes, do a telehealth consult, maybe it's equipped with some things that can help with that process, welcome the opportunity, understand you're protected by federal law, and go with it because it is the future and it's going to make you happier, give you more time in your day, and health wealth is all about the employer enabling a lot of these things. So I want to go back to a statement you made, because I never really heard this before, and you're the expert that would tell me this, which is that maybe President Obama did want single payer, but knew he couldn't get there, so this was a compromise, and maybe, I'm fascinated by that. So tell me a little bit more about evidence.
President Obama was incredibly disciplined in his public statements, but there were, during his presidency, people went back through the record of some of his speeches, and there were 2 or 3 occasions on which he made speeches in which he explicitly said that single payer was an option that he wanted. He even in the later part of his presidency, or immediately after he stepped down, acknowledged that was the case. And the problem is, there's 2 problems with that he acknowledged. One is that we haven't solved the financial problem, as you pointed out rightly. Single payer is it sounds great in terms of solving the problem, but it really it's not clear where we're going to pay for, how we're going to pay for it. And the other problem is that it's divisive. First of all, the models of single payer that are out there are scary in terms of the level of expense. I have a client who does business in the United States and in Europe, and tells me that as expensive as we think our healthcare is, by the time they get done buying a supplemental private policy in France on top of the public system, it's just prohibitive. So I think President Obama was more of a pragmatist than people give him credit for being. But the problem is now that there's really not a consensus for a compromise. So the real question is going to be what happens in 2021 under our next president. If that president is from the Democratic Party, are we going to see a political push for something like what Bernie Sanders has been saying, Medicare for all? It depends on where you stand politically. I don't want to get political, and like you, I try and avoid being political because I don't think it's conducive to problem solving. But it's going to be if you're looking from a standpoint of access to care and you're a progressive, then it's great news. If you're a fiscal conservative, you're wondering how business is going to and individuals are going to be doing financially when we have to cover the burden of it. It's terrifying. So I think that we have a serious problem ahead on our hands. And the only good news, I think, is that fighting for healthcare affordability for consumers, for employers, helping people find the pathway there is our best hope of having it be, whatever way we go, being as soft a landing as possible.
Yeah, and so I know just historically, because this is something that on social media and even in my discussions with students at USC that I know feels political even though it's not. I've always been an advocate, because I ran safety net hospitals, that not every American wanted health care. In fact, the folks that were coming to my hospital that knew healthcare was free in the emergency room, they would look at you like you're crazy if you said, "Hey, great news, it's $350 and your family gets care." They'd say, "I'm not interested."
Right.
And so what the Trump administration has done is move towards undoing the mandate. And I guess my question is this. Is that a more sensical approach, whether it's the Bernie method or Medicare for all, or whether it's Democrat, Republican majority? Has time shown that with the failure of many exchanges and now the undoing that, hey, there's a way to give affordable health care without requiring it? What are your thoughts on that?
I think this is a tricky.
Yeah,
it's a tricky
it feels
issue.
political, but
What I'll say is, I think from my standpoint, we've been talking this whole last 20 minutes or so about employers and individuals taking control. And what scares me about a Medicare for all system is that Medicare doesn't have any answers, right? Medicare is the Medicare system. Between Medicare and Medicaid combined, we're on track for them to cost $1 trillion, right? It's the single largest item in the federal budget are these entitlement programs, and I'm not sure that the government is doing a great job of driving us towards lower cost, higher quality. I personally am much more optimistic about employers and individuals doing that. And so if you look at what Medicare for All means, it means employers losing control, essentially being forced to buy into a government system. Here in California, we had an effort at the beginning of the last year for single payer that was going to do the same thing. It was going to basically take power away from employers. So without getting political, I personally have put more hope in the individual consumer and in the employer to make choices that are consistent with what we want and with good health. Now, that said, I do think we have some obligation to ensure that everybody has access to some level of care. We have a big struggle ahead because there is inequity in the system, but I personally am a fan of a solution that doesn't disrupt the employer system that we have. Which isn't perfect, as there's a lot of work to do.
Sad options. I agree.
But I think if I was an employer, as an employer, I have about 75, 80 employees between the law firm and our affiliates. I personally would rather have a little bit more power and autonomy rather than having to be in this single payer system.
I agree. So I have a few more questions, and Harry made a comment a few minutes ago about how he believes that more of your healthcare is in your head and on your own decision than it is about the delivery and the hospital. And I completely agree with that. I'm a big proponent of the term healthcare lives in the clouds, and particularly with seniors, the cloud being, all of your family members, your caretaker, your spouse, your pharmacist being able to contribute through cloud-based technology, even like a group text is the way you would think about it, is just as relevant, if not more relevant, than your electronic medical record, which is just kind of a picture into your life that day you went to the hospital or the doctor. So on that note, we talked about JP Morgan, Amazon, Berkshire Hathaway, Disney, Apple, and you can only expect that Microsoft and Google are coming. It's only going to be a matter of weeks before you hear something about what they're doing. And guys, that's not to say these folks already weren't in this game. What's changed is January 1, 2018 came, and people reached their tipping point and said, we just can't do it. And literally within a matter of 4 weeks, you heard these 5 massive things. We didn't even mention Intermountain Healthcare and Ascension partnering up with several others to say, we're blowing up how we order pharmaceuticals. We're starting our own pharmaceutical company, and now there's a war starting, right, between big pharma and health systems. So I'm really excited about this, but what are your thoughts about healthcare and the clouds? Have you seen a movement towards this, as opposed to big EMR, who has controlled hospitals and has controlled really the slow trek to value-based care?
Are you talking? I'm not sure I understand your question.
Just the cloud, meaning it's almost like the group text, or it's about Harry taking control of his health.
So so 100. I think you're 100% on right there. The one thing you hear over and over again, I talk to a lot of health system executives, health system leadership, and you hear more and more social determinants of health. And what does that mean? It means that our health is not ultimately just about it's not just literally our physical health. It's also our environment, our education. It's our social support network, right? I really think that's what we're seeing is that is absolutely critical. So, for example, I moderated a panel a couple of weeks ago with the CEO of a local health system, and he was talking about the fact that they have volunteers from the AARP who come and they just call seniors at home and check in on them, see how they're doing, right? And literally just addressing loneliness in the home with seniors improves their health, right? All of us feel better when we're connected, whether we're connected to family or whoever it is in our community. So I think looking at social determinants of health and how we can use them to keep people healthier longer, to keep them at home, out of the hospital, out of the nursing home, and help people bit by bit, and looking at the environment, looking at where are the health risks around us that we may not be conscious of, and it may be, ironically, that sort of making sure somebody has good phone connectivity is the solution, actually is what's going to reduce their healthcare costs. So I think that this is it's a critical point, and I'm excited for the fact that the more we look analytically at a system level, we're seeing more focus on social determinants of health.
Well, and in all three of my books, Readmission Prevention, which was, back in, I think it came out early 2015, the first week of 15, talked a ton about social determinants. And then Execute, we got into a little bit, but here's what's interesting, and that leads really well into our next question. The health systems have been controlling healthcare. And the EMR companies, in large part in pharma, have a tremendous influence over health systems. And in 2010, Obamacare gets passed, and there's not much movement from the health systems towards value-based care, even though the laws said we're going to force you into this. In the last 3 years, we've started to see movement. We've started to see all these penalty programs stack up. They're starting to take a dent. Health system said, well, even if we don't like it and we still want to play the heads and beds game, we better learn the best way to deliver this care. And Harry just made a great point. The health system has volunteers that they don't pay, because they wouldn't pay them, to call patients to make sure they're well and at home, which they don't get reimbursed for, which is why I made the statement they will never pay for it, because the reimbursement model hasn't changed except slightly for gain sharing, and it's still a small percentage of their reimbursement. And the Obama administration was forcing them slowly to make it larger and larger portion of their reimbursement. Trump administration still hasn't addressed that. There's no law forcing it. But do you see this balance of power with what we've seen in January and February 18 from those 5 or 6 big international juggernaut companies I've talked? Do you see that power, that influence of the health systems being able to control the slow trek of change being wrestled away finally?
Oh, absolutely. I think, yeah. No, I think it's a great point. I think that's what the employers are pulling power away from the systems. And by the way, what I think the systems are going to end up with is, and I think the reason that they're moving is less about the specific initiatives now, but the writing on the wall, which is the government. The simplest way for Medicare, for Congress to stop spending on Medicare is just shift risk and say, we're done being a fee-for-service program. We're going to basically make you, the health systems, bear risk. You're full risk. Congratulations. You solve this problem. So I think the health systems are really under fire. They've been under fire. Their business model's been really upended in many ways, and I think that's going to continue.
And so when that happens, we're going to start to see all the lists that I saw last week when I posted, the $100 and so million profit that one of the insurers posted last year with a sneaky comment that said, "But you can't afford health care as long as they have a $100 million profit." So I would imagine that the result of Medicare finally saying, "Hey, we're going to shift everything to Medicare Advantage and no longer be in the insurance business." Do you see, and also the announcement this morning that we read that one of the medical directors for Aetna apparently has never looked at a medical record but denied cases every day. Did you hear that? I heard that this morning. I went, uh-oh, this one's going to get ugly. But it's things like that the government says, how can we shift this to private America if those things are happening? So are we going to see a bunch of regulations come along with that shift?
Well, it's going to depend on which party's in power, right?
Yeah.
This government, this administration seems to want to lessen the regulatory burden, and we're seeing the impact of that. So you're right. It may be that it's going to be hyper-regulated. That'll keep people like me busy. That's our.
That's good.
but I do think we're heading to. I don't. If you're whether you're an employer or whether you're a health system, a healthcare provider, you have to be thinking about how you exist in a full risk environment.
Yeah, no doubt about it. So I want to mention also that you can see Harry and myself at 2 upcoming events in Los Angeles. On April 26th, the USC C-Suite Invitational is in Los Angeles. Harry or one of his partners will be present on one of the panels there. That's a 3rd-year event. We have executives from most major health systems in Southern California there telling us how they're transforming. Providence is going to be represented among several others. UCLA and some others are represented. Harry will be there if you want to get some access to him on some of those things. Also, a couple weeks later, a really unique event that Harry and I have been included in that we're really excited about because we're not sure where it goes from there is called the Masters of LinkedIn Summit. And it's the first ever Masters of LinkedIn Summit that's been hosted. There's others being planned now in Toronto and London and Dubai, but Harry What's interesting is if you might think we're influencers until you look at how many followers the other people that are coming out, they have like 300,000, right? But I think what Harry and I are going to end up talking about that day is a lot about how our followings are semi-niched, and we want that. We're not so much into the 300,000 followers as we are into having the right 30 or 40 or 50,000 followers. Because what Harry and I, and here's a little social media tip for you, and Harry and I talk social media strategy often because it changes every few months, right? Some of the best growth that we have both seen is by using multiple types of we use long form, which is a long form story, which right now aren't doing great because they've shifted to video.
No one's reading anymore.
We use video, and we also use short form. And let me give you an example of the best growth I've seen on LinkedIn. When Harry posts a story that I know is relevant to my audience, I share his story and say, hey, my trusted colleague Harry, the best healthcare attorney in America, great article. Here's the point I want you to look at because I know you follow things that are relevant to me. You might not know everything Harry's talking about here, but short form is me putting my filter and spin on his story and him doing the same. To the point, and kind of the pod trick is out of that dog's left the stable or whatever the term is. People know now that there's these pods where you join a pod and it's 20 other people and you agree to like and share your friends' stories. I'm not a huge fan of that because it doesn't help your brand if you're sharing and liking things that don't help your audience. Think of your audience as subscribers. But I wanted to make sure I mentioned that Harry will be at those two events in Los Angeles, and you can check my LinkedIn or his LinkedIn to learn about either of those events. But tell me about how you use social media as an attorney. How are you using it to make yourself stand out?
Yeah, no, by the way, I have to thank you. In addition to advancing the conversation on healthcare, you've shown me a lot. I've learned from the time I've been working with you, and it's very engaging. You know, for me,
time-consuming.
I'll tell you, what I realized was, as passionate as I am about the work that we do, one of the sort of the fun of being a lawyer is healthcare providers, health systems, investors will come to me with tough problems and let me solve them, but I often have to do so in secret. Mm-hmm. The problem is we build up all this expertise and we want to share it. So for me, what's really exciting about social media is it's an opportunity to take some of the learning observations and share them with a bigger community of people, and to be more socially impactful, to be part of, it really is the way to be part of the discourse, right? I think if we lived 200 years ago, maybe we'd be writing pamphlets and circulating things, but I think it's incredible that we can share an idea, whether it's by video increasingly or just sharing long form, short form articles, and really get feedback on them. And what I've seen is that it actually does, at the end of the day, I don't do it to build my business and to find clients, although ironically, like it does lead to higher visibility. Sure. That's an outcome, but that's not the purpose. The purpose is to really connect with people, share ideas, and help people advance healthcare. And what I found is that I found incredible people out there doing really amazing work that's transforming healthcare. And connecting has really been a privilege. So I'm excited about the. I never thought of myself as a master of LinkedIn, but I'm very excited and really humbled, Josh. And again, I want to thank you for really advancing the dialogue and pushing forward. I think you really are making a difference in all of our healthcare. So
I enjoy it, and thank you. And I do think it does make a difference. It's a lot of work. Keeps you and I up a couple extra hours some days. So a couple of last questions. I get this question a lot, and I'm going to put Harry on the spot here. In my research, I learned that there are companies, particularly in the Midwest, that will not hire smokers. Yep, they won't hire smokers. And I get asked that once in a while. And people say, can that happen? Can you do that? I said, well, gosh, I live in California, work in California. I'd be afraid to even bring that up because I'm not sure if I could get away with it in California. But I know in our trek towards living healthy, reducing our healthcare spend, there are companies that have done this. Harry, I get this question all the time. Is it legal? Is it a state by state? Is it a case by case? Give us your best guess at if this
is. Okay, so I'm not an employment lawyer, but I'll tell you, I believe it is a state by. You have to look state by state at everything in American law. But generally, the question is it a legitimate qualification for the job? So somebody's engaging in a legal behavior, but an unhealthy behavior. Certainly, for example, if I'm a trainer at a gym or I'm a public personality, if I engage with the public, I cannot be. Employers have the right to tell employees that they cannot be smokers. They can't, because smoking isn't just being seen smoking cigarettes, but it has all of these outcomes. I don't know that it's for every job, and I honestly, I would definitely encourage people to
call Harry if you're
we'll talk to employment lawyers. I'm a healthcare regulatory lawyer, but I do. We are seeing that it's not. There's certainly no protection, right? The things that you can't. Obviously, we have all these laws to protect people from being discriminated against on the basis of disability or their ethnicity, their race, and sex, and so on. There's no protection for being a smoker, being a marijuana user, being all of these things. So we are moving to a point when I think the general trend is employers are going to be much more active in regulating health, right? And then you get into questions of when is it a disability. And when isn't it?
As I'm listening to you, that's what I'm thinking. So the next 10 years, you're going to see this massive wave of employers say we don't hire smokers, and then you're going to see the same wave we've seen the last 10 years, which is, my medicinal marijuana use is medicinal, so we'll see the same thing. So right. I want to wrap up because I don't want to go over time. I want to also share one of the most flattering things that's happened to me in my career, and it did come as a result of my LinkedIn usage, is when Forbes Books reached out to me and asked me to write this book on healthcare affordability. And I'm happy that it's come to fruition, Health Wealth, from Forbes Books. You see it right there. But guess who else got recruited by Forbes Books to write not just one book, but two? And that's what I said to him. I said, hey, when you get these books out, he goes, man, I got to get busy. I got a couple coming. So I'm excited to say that Harry Nelson has also been recruited by Forbes Books. Tell us about the two books you have coming out and about when people can expect them.
Yeah, thanks. So we're a little behind on the first one. The first one is we're expecting it to go to print in late spring, and it's going to be really about the past, present, and future of U.S. healthcare, like where we are heading. Our goal is to be less about making specific predictions for the next couple of years, but really looking at what is the transformation ahead in U.S. healthcare and what are and really drilling down on some of the particular issues like honoring end-of-life intentions. The whole struggle around end-of-life care. Talking about really the way that single payer is going to play out. So that's the first book, and then the second one, which we're expecting in the fall, is to be finished, to publish in the fall, is on the opioid crisis, and really getting into the weeds of how are we actually going to tackle this problem, because the opioid crisis, the death rate certainly has spiraled up. Last year, the number was 52,000 Americans dead of an overdose. This year, it's 64,000, and that's just the deaths is just the tip of the iceberg on the biggest public health crisis that America is facing. So I think it's a long battle ahead, but I'm excited to be contributing by taking some of the work that we've been doing and sharing prescriptive solutions for how employers, individuals, government can work together to really begin to stem the tide and lead to addressing this public crisis.
And in that first book that you're going to see from Harry, you're going to hear a lot about some of the things we talked about today, that you can't have this discussion without talking about some of these things. Harry, show us your last book one more time. Stick in the camera there.
Yeah, From Obamacare to Trump Care.
Hold it closer so you can, right there.
It's available on Amazon and in fine bookstores, and definitely appreciate your support for it.
So one last thing I want to share, and Harry doesn't even know this yet, it's not on his calendar, but I'm going to make sure I get him there. We're having the first ever Health Wealth Summit in Los Angeles in October. We already have a number of huge speakers that talk about the things that we've talked about today scheduled to come. It's going to be a broker and employer event. It's going to be the first of probably many more to come in 2019. This was an idea we were tinkering with until Apple, Amazon, JP Morgan, Disney, and everybody said it's time to have this conversation. So hopefully you'll be able to see Harry, and if not Harry, one of his partners, I'm sure will be there as well.
Looking forward.
Yeah, I want to close by asking the same question we always close. Another question I didn't prep him for. What is your favorite sports team to root for, whether college or pro?
Well, I'm a Michigan Wolverine, so
that's right.
It's certainly college, and then I've raised my kids to be fans of Detroit sports teams. Detroit Tigers, Detroit Lions,
awesome.
Red Wings. So
cool.
I'm trying to keep the Midwest alive.
There you go, awesome. So hey, I want to thank my longtime friend and colleague, Harry Nelson, the best healthcare lawyer in the country. Nelson Hardiman Law. If you want to know how to spell Hardiman, it's right behind us here. Just turn your head to the side. Look him up on Google, or just check out Harry Nelson on LinkedIn, and you'll see some awesome stuff. Follow him as well. Thanks again for tuning in to the Health Wealth Podcast and Radio Show. It's Dr. Josh Luke with my friend Harry Nelson.
Josh, thank you.
Thank you.
Thanks for tuning in to this episode of the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.